everyone.
Hello.
Peptic ulcer is a common disease which presents symptoms that can be prevented and treated. Therefore, my primary goal of this speech is to inform you all about peptic ulcer, a disease that can turn to fatal if not treated correctly. Approximately 75% of individuals with peptic ulcer disease, in short PUD, do not experience any symptoms. Usually, such people will find out they have PUD when testing for other conditions, such as acid reflux or chronic heartburn. As a public health advocate, my goal is to raise awareness of the current future health threat to the well-being and health of community. Today, I will talk about the following: the cause of PUD in your stomach, the symptom, and lastly, treatment option, as well as prevention. So what are the causes of PUD? Let me explain to you that peptic ulcer are sores that develop on the small intestine, stomach, or esophagus lining. PUD is caused by the imbalance between protective factor of the mucus, duodenum, and stomach factor, causing damage to it. Many cases of PUD develop because of bacterial infection eats the protective lining in the digestive system, such as bacteria Helicobacter pylori, and pain relieving medication. Secondly, what are the symptoms of PUD? Those individuals, duodenal and gastric ulcer, present similar symptoms such as epigastric pain, nausea, postprandial distress, bleeding, and bloating. Actually, PUD symptoms tend to non-specified and can be challenging to differentiate clinically from functional dyspepsia. At the same time, patient might face complications such as obstruction from fibrotic structuring, penetration to neighboring organ, perforation, and bleeding. Last but not least, knowing how to prevent peptic ulcer for yourself, your family, and everyone you know, as well as treatment option, are most important key for the future well-being. There are 3 ways to detect the disease. Endoscopy, which recommend if patient has severe symptoms. This is the method that inserting an endoscopy into the stomach to look through for abnormalities. Imaging test, which is commonly used by using CT scan, X-ray. The patient will be required to take a special drink which will coat the digestive tract, making ulcer visible to the imaging technology. Helicobacter pylori test is the test that provider use to customize treatment plan to kill the bacteria and reduce symptoms. Stool and blood tests can be used in this case. Treatment options for PUD include using proton pump inhibitor to reduce stomach acid and allow ulcer to heal. Using antibiotic to treat Helicobacter pylori infection, or using protective medication such as protective layer cover the ulcer to prevent further damage because the digestive enzyme and acid. In general, PUD is a common disease that can be easily prevented and treated, but it can become more complicated and dangerous to life if not effectively managed. Hopefully, you all now understand the cause of PUD in your stomach, the symptoms, and the treatment option. Thank you for listening.